So it's a single upright.
Yeah.
And what normally happens in knee bracing is the straps pull across the joint and open the joint, right?
Yeah.
Well, a couple companies have tried that. And now with 3D technology and his input in totally changing the technology, we've turned this hinge into a dynamic hinge that distracts.
Oh, sick. I didn't even pick that up when I was doing it first.
So it opens up across the joint.
What are your thoughts on that kind of device where it actually axially unloads the joint?
I love the concept because it's a seemingly lighter brace that has more of a functional compatibility with activities, which is what we're trying to enhance in our patients.
Yeah.
So I like it.
Okay. Cool. And one thing about it is, so it's medial OA, or we can make a lateral version also, but it also has potential to be a post-op meniscal repair unloader, root repair unloader. Could you see a place for it in that role too?
I do, and I think I would be efficient in developing the lateral side because that's a big number of folks. Big number of folks. People have lateral compartment stuff.
Okay.
The lateral compartment is just not forgiving for getting lateral compartment OA. So these devices will really help.
Okay. Put it on at 90, so it's in a fully contracted state. And then these guys are the ones that really have to be snugged up. So what these are doing are, these are pulling your leg in. And so, yeah, go ahead and stand up again. Okay, so you can see it translating. So it's pulling your leg over this, it's pulling you into valgus, and it is also prying apart. So I can feel it's kind of tight right there. So if you had medial compartment pain, can you feel any pressure anywhere?
Yeah, I mean, I feel it now better. I mean,
yeah.
That's what I'm interested in. How does it affect running?
Yeah. So we're seeing Mark, our VP of sales. He has 16 degrees varus.
Wow.
And so we put this brace on. I mean, you've seen his meniscus. I have tons of patients, but he's got pretty serious, significant bone event. So, and pretty significant varus, of course. So that actually corrects him to 12 degrees of varus with this thing. So it's actually changing your tibiofemoral length. And it's
feeling what it does.
Yeah. Medial, lateral. Okay, now we have an amazing solution for that. Okay, so this is called a distraction hinge in the Adonis. The way it works is when you go into extension, it translates axially and pries the joint apart. And then feel how light that thing is. So it's the lightest. It's about half the weight of any other unloader.
Yeah, I think the distraction concept we've looked into from, across the pond for a long time for some of these really complex, arthritic problems. And so applying that kind of concept to a brace is really intriguing.
Yeah. That's
Can't get over how light this is. So it sits on which side, the affected or non-affected?
On the affected side.
On the affected side.
Which is good. Usually you've got somebody with varus, so oftentimes there's room.
Can I put one on?
Yes, but I want to show you something else first.
Yeah.
Okay, so you can see how this thing works. It's in a contracted.
Yep.
When you go into extension, then it starts to distract.
Okay.
Okay, so watch what's happening inside the joint. So as you go into extension, so it's bone on.
Do you know how much force it's taking off, or how much pressure?
The force depends on how tight this is, but it's a whole nother mechanism.
And it's this plane?
Exactly. So.
Wow.
Right. So literally creates joint.
So no
space.
push pull, just apart.
There is. It's two stages simultaneously working. So it pulls while it pries it apart.
Okay.
So I kind of call it like the 1-2 punch.
Yep. So it's a pull and a pry.
Nice. Yeah, exactly. So, any thoughts?
That's interesting. yeah, I think, the light aspect of it, combined with the potential power to unload with those dual mechanisms, is very intriguing.
Would you see, so obviously medial and lateral,
Mhm.
because we can do the same thing
Yeah.
laterally, OA, unloading for OA, but what do you think about post-op, like repair, eating meniscus?
Yeah, I don't think it has to specifically be for OA. I think it could be for any, sometimes we're even talking about unloading in neutral. So they don't even have to be like major varus or valgus. If you have a root or you have a cartilage restoration case or something that you just want to take stress off of that compartment, I think it's interesting. And it's, so lightweight that I think out of that initial phase of rehab that the patients, will likely, similar to how they might adopt like a sleeve because it's lightweight and comfortable, like this is a pretty small adjunct, whereas sometimes like even other braces for other reasons are bigger, right?
Yeah.
So I think that's another interesting component to it.
But now, so it's put in a contracted state.
Yep.
We would want to give you a custom.
Yeah.
Or
Yep.
yeah. So the tightness of these two straps control the intensity.
So the tighter,
of
the more distraction. Yeah,
exactly.
So the more you can tolerate, the more it'll distract.
Yep, exactly. And it's a little on the tight side, so you're
Okay.
gonna feel it because
Yep.
it's over your pants.
Yeah.
There's the Adonis.
My new beautiful Fig ISMF scrubs. Yeah.
Can you feel some pressure?
Yeah. It's tolerable though. Yeah, I mean, so it's interesting. My pain is posterior for whatever. I have swelling from carrying my son at Disney World, and in this thing, well, I'm not like stretching out the back. It's not hurting at all. It's really interesting. But it definitely is. It loads here and here, right? Which is what it's supposed to do, I'd imagine. But then if I want to distract, I can go more. Like, when does it start engaging the distraction? What flexion angle? 45? So it's already doing it from, okay. So that's 90, and then, so throughout some of that. Interesting. How's it looking?
You look amazing.
Feels good.
But it's on the bare leg. It's nice. It looks good. It feels
I'd
good.
probably wear it under my beautiful figs,
Yeah, you would.
not over it. Yeah. That's great.
Yeah, that is pretty impressive how it does distract. I mean, it's you can feel it as you're standing, going from that 90 to full extension. You do feel it creating, unloading. I mean, this is the most active unloader I've felt. Let me put it that way.
And that was just from standing up.
Yeah, just from standing up.
Take a walk.
Yeah. Going through. Let me check this out. Yeah, no, it's pretty. Honestly, I've had every unloader, and you never feel this much of an unloading as this one. No, I mean, honestly, I have tried. Unloaders are weird because they're trying to force your leg into valgus, and it just doesn't. I think it's the wrong concept because it's not comfortable. This is actually kind of springing that area open, dynamically, which makes more sense to me. So, yeah.
Okay. Tell me, could you imagine this being useful for protecting a meniscus post-op?
Yeah, I mean, I think this would be cartilage work, any sort of joint preservation procedure. Because when I get my patients out of their initial post-op brace and they need their sort of protective brace for their getting back to life, I think this is a great option because you really feel it. I mean, the other one, you're like, maybe it's doing something, maybe not. But if I had a medial meniscus transplant and a fresh osteochondral allograft, and I'm getting out of my brace, and then I would feel more comfortable as a patient with this on because it feels like it's literally preventing anything bad happening to that side. So, yeah. So I think that's a good market for this as like post joint preservation service. Yeah.
Yeah, we have a couple docs who they'll get them in this brace 1 or 2 weeks after meniscus repair.
Right.
And that's the recovery.
Yeah. No, I think it makes complete sense to me. I like it. Yeah.
Can you see what I'm saying about it doesn't migrate?
Yeah.
It's not gonna go anywhere,
Yeah, it's not going anywhere. Yeah, because most braces, as soon as you've walked, 20 feet in them, they're starting to move around. You got to pull it up, but this is staying put. For a non-custom brace, it's staying put pretty well. So.